We as a community understand the burden of the disease from our peers, friends, and our affiliated CBOs. We came to know the prevalence about hepatitis C among people who inject drug. But due to the lack of authenticate data in the state, it is really hard for us to convince our government the burden of disease.
Of the 88 million people with chronic HCV infections, 80% reside in low and middle income countries. While much attention is given to the challenges, there is little attention given to the work of community and advocacy groups. With little government support and limited resources, community and advocacy groups globally are rallying in the fight to eliminate hepatitis C. Our stories from India, Thailand, Ukraine, and Georgia are a reminder that the fight against hepatitis C will be won from the ground up.
Some of the studies indicate a prevalence of 92% among people who inject drug in few districts. And in one of the serological survey which was conducted by my organization in partnership with Directorate of Health Services, Government of Manipur, we were able to collect 1,011 blood samples randomly, out of which 83% of them were tested positive.
Majority of people in Ukraine have to pay for diagnostics and treatment out of pocket, and since our living standards are very low now due to the crisis, due to the war, most of the people can't afford neither diagnostics nor treatment. That is a real problem.
Hepatitis C testing is not available at free of cost in government health setting. They charge for 100 Indian rupees per test for the antibody test.
Still, you know, PWDs are very much stigmatized in Ukraine, and that is why, you know, the reality is like that. They don't have treatment under the national program, but we are providing them with Hep C diagnostics and treatment now, and we are doing our best to scale up access to treatment. And that became the reality due to all our advocacy efforts.
Since the war on drugs in last 10 years, many cases can present about human rights violence. For example, during that time, more than 2,500 was killed. Until now, still don't clear like why those people was killed and who's killed them or why they got killed from that situation. And like that make drug user like they feel like, oh, now I don't have my right anymore. So when they believe like they don't have like their own human rights, that is the problem.
Manipur is such a state where there is no law at all here. Police or whoever or any other civil society can do anything, whatever they want against the drug use community. In my place, people are not allowed to carry clean needle and syringes openly in the street. That is the reason why sharing of injecting needles is still going on. If they found drug users with the syringes, not forget about drugs, with the syringes, they will be caught.
In 2011, we organised a street rally because even then no one in any government agency or the community was talking about our country's large problem with hepatitis C.
In 2013, we started with educating communities, educating medical doctors. We provided them with information what Hep C is, how to treat it, how it is treated in other parts of the world and how it is treated in Ukraine and what should be done in order to improve the situation. Very often when patients were tested, just accidentally, were tested and said, oh, you have Hep C, but go home, we can't do anything about it, you can live with it. You will live like for 20 or 15 more years, and that's fine.
As you know, the drugs law and drug policy make the drug user run away from the community. If we have a drop-in center like this, that means they have the choice for the drug user to decide where they would like to go or where they feel happy to go.
And safe.
And safe, yes.
We are the one who can really motivate our people to come forward for treatment because they trust us.
We also talk with many sectors of the community, like the hospitals, the community leaders, the religious leaders, quite important because here is Muslim communities. And also we also talk to the police chief in the community also about we works also. But it's not all the people in the same time. We go like one by one. We work closely with the hospital first, and then go to the community leaders, community religious, and then ask the people who already understand us, go together with us to talk to the police or law enforcement also.
Through our community effort, we became co-participants in a truly unprecedented project with the Atlanta CDC. This program aims to eliminate the disease within all of Georgia. It is likely that we will be the first country where this huge objective will be achieved.